Right. Hello. We'll have a small talk on cystic kidney diseases, which comprise a heterogeneous group, which has those that are going to be developmental disorders, some that are acquired, and some that are actually going to be hereditary in nature. And we're going to classify our diseases into groups. So we'll group them into various clinical entities. So I'm going to number these. Okay, so I'll do this. Right. So we are going to number them from number one. So I'm going to use this list that I'm going to be writing here to number our disease. So we have what we call polycystic kidney disease. And this polycystic kidney disease, it can either be autosomal or dominant. Autosomal. So I will use abbreviations for the purpose of space. It can be autosomal or dominant, which is the adult form. So it can be autosomal or dominant, or it can be autosomal recessive, which is the childhood form. So these are, we're going to talk about polycystic kidney disease, both the autosomal dominant and the autosomal recessive. Then we have what we call medullary cystic disease. Under this, we usually talk about what we call medullary sponge sponge kidney. We also have what we call nephro. How do I spell this? Nephro. Versus right. Then we also have things like renal cysts, in hereditary malformation syndromes. Then we also have multicystic. This is where we have more than one multicystic renal dysplasia. Then we can have simple cysts that are localized, that are simply just localized. Then we can have extrarenal cysts. Okay. Right, that are going to extend beyond your confines of your renal parenchyma, right? So for polycystic kidney disease, remember I said we have autosomal dominant polycystic kidney disease. This one is the adult form, and it's a hereditary disorder which is associated with multiple cysts that are affecting the kidney parenchyma, and it has that inherited pattern that is autosomal dominant. Remember this when you're comparing it to the other one, which is autosomal recessive, the childhood one, right? And then in terms of the genetics, this autosomal dominant is linked to mutations in the PKD1. So I'll write this as PKD1 and PKD2. PKD2 genes. So there are mutations for PKD1 and PKD2 for the autosomal dominant one, right? And usually we don't really talk about the things that are happening, like the products of these genes. For the first one, there is polycystin 1. The second one, there's polycystin 2. We don't usually talk about this, but in terms of location wise, the PKD gene is located on chromosome 16, P13.3. Then the PKD2 gene is located on chromosome 4, Q21. right? But we don't usually go to the details of how this polycystin will affect the cells themselves, right? Then morphology wise, for polycystic kidney disease that is autosomal dominant, the kidneys are both bilaterally enlarged, and they increase in weight. They're going to have solid cysts within them. They can be hemorrhagic. They can be filled with some sort of fluid, can be serous or even mucus. And people who have this autosomal dominant polycystic kidney disease, they will also have extra renal congenital malformations. So they also have malformations in other areas, right? So you can think about things like liver polycystic disease. They can have very aneurysms in the central nervous system. Then for autosomal recessive polycystic kidney disease, this is in childhood, and it's different from the one that we're talking about. So it can be further subclassified into juvenile, neonatal, infantile, and the likes. And the gene for this one is the PKHD one gene. So I'll write it as PKHD one gene for the recessive one. It's on chromosome 6p 21 all the way to 6p 23. Right. And unlike the other genes for that were encoding polycystin, these ones they code something called fibrocystin. Right. Morphology wise, the kidneys are also enlarged. However, they have a smooth external appearance, and they appear like a sponge for the medulla. Right. Then they since it's appearing in early childhood, I find that some of these children will succumb to this. Some of them will survive to early childhood, where they will have some liver problems as well, right? Then medullary sponge disease. This one is because this is restricted to the medulla of your kidney, right? So it affects the collecting ducts that you have, or the papillary ducts that you have in the medulla. They're going to be dilated, and they have small cysts within them. Right. The nephronophthisis. This is now where you have a variable number of cysts in the medulla, which are usually concentrated at the corticomedullary junction, which is the junction between your cortex and your medulla, right? And these ones, they present with small kidneys, and they also have cysts in the medulla, right? And they are most prominent at that corticomedullary junction. Then multicystic renal dysplasia. This can be unilateral or bilateral, affects both sides. And the kidneys for this one, they're also going to be large and irregular, and it's multicystic as the name tells us. Then simple cysts, they may be single or multiple, and usually they are in the cortex, so they are not medullary in nature as the ones that are listed under the medullary there. Right. So this is just like naming these cystic kidney diseases. Right. It's not really describing them per se.